Here, watching on Facebook or on Teams, welcome to our San Antonio Market Access to Care Town Hall. We look forward to sharing our latest access to care tips and initiatives. Today, we are privileged to have the following leaders on our panel. Welcome to Brigadier General Janine Ryder, Director, San Antonio Market, and Commander, 59th Medical Wing, Wilford Hall, and Brigadier General Deidre Tahan, Market Deputy Director, and BAMC Commanding General. We also have 59th Medical Wing Command Chief Master Sergeant Christy Earls and BAMC Command Sergeant Major Thurman Reynolds. They are joined by Colonel Heather Yoon, Deputy Commander for Medical Services, and Lieutenant Colonel Matthew Garrido, Chief Behavioral Health. We have a full panel today. Welcome and thank you for being here. To start, panel members will give brief opening remarks followed by a question and answer portion. Everyone is welcome to start submitting their questions in the comment section on Facebook or through Teams. Throughout the town hall, I will share as many questions as time allows, while also including our pre-submitted questions. Thank you to everyone who took the time to send those in. At this time, I'd like to welcome Brigadier General Ryder to give the opening remarks.
Good morning. I want to thank you for joining us for our first San Antonio Town Hall for this year. We look forward to hearing your questions, to answering your questions, and our goal here is to have transparent communication. We have lots of successes and lots of challenges, and we understand that we need to give that information out. The first thing I would like to do is to thank our outstanding beneficiaries. Whether you are weathering a storm like we had last week or navigating a new electronic medical record, our new portal, you've been flexible, resilient, patient, and understanding, and so we very much appreciate what you do. And I would also like to thank our amazing staff. We take care of the best patients in the world, and you, with your expertise, your leadership, your commitment to the 250,000 beneficiaries that we have in the San Antonio market, General Tahan and I and Chief Earls and Command Sergeant Major Reynolds could not be more proud to be leading this market, and so we thank you for what you do. We know that this particular town hall is an access, and that's what we are going to concentrate on, but we will take any questions that you have today. We realize that there have been challenges, whether you talk about the pandemic and where we had to make sure we had capacity and capability, whether we had to send teams out there, and then the MHS Genesis put us at some challenging areas. And so what we will like to do is share the information that we're doing, how we are getting at primary care and the access, how we are doing walk-in, contraception, all those kind of things to make sure you get the access to care that you need. And that also how we are working on surgical optimization, how we are making sure that the right cases are done by the right place at the right places with the right expertise. And so I really thank you for your involvement and your participation today. Chief Earl?
Ma'am, I would also just echo that we are all patients and our families are enrolled in this market as well. So we hope that you realize that it is not lost on us, the challenges that we face, and we appreciate your feedback and your questions today. We look forward to being able to share information and to be able to address some of your concerns. And as we continue to strive for improvements and optimizing the processes that we have, while we keep safety as our #1 priority and providing a positive outcome and patient experience for you as our patients. And so I think General Tahan and Command Sergeant Major Reynolds also have some information that they'd like to share with you in regard to our ancillary services today. So we look forward to hearing from them as well.
Good morning, everyone. I'd love to echo General Ryder's opening comments and thank you for being part of this today. Whether you are beneficiaries that are learning how to better access the system and the care, or you're one of our staff members wanting to figure out how we can better care for our community, we appreciate you joining in today. One of the things we've been really working hard on is improving access to care. And so we have created a new guide called the San Antonio Market Guide, which really allows you at your fingertips to quickly see how to access all the different resources available to you. We know that not everyone wants it in paper anymore, so it's now on a new app that you can download, and we've made it accessible for all the cell phones out there, so you can actually download that app and have answers to most of the questions people ask us every day, easily available at your fingertips. The other thing I want to really brag about and give you an example of just the improvements You know, last year when we went live on MHS Genesis, which was about a year ago, you know, you saw pharmacy wait times go up, and they got up to close to an hour. Now they're all across the market under 30 minutes. And part of that real benefit of getting it down as low as it is, and I'm sure pharmacy would like me to make sure I clarify, it's closer to less than 25 minutes than 30 minutes, but nonetheless, it is incredibly getting cut in half, is because we've offered new services. One of those is called Q Anywhere, where you can use your phone and text and get into line to activate a new prescription. This makes it so much easier to get your new prescriptions, and I'm sure we're going to go into further questions on Q Anywhere as we go along. The second one, which is my personal favorite, is the pharmacy lockers. So when I call in for a refill, I actually select the locker location, and then once I have my account registered, I just go up and I only need my thumbprint, and I can actually open my locker and get my prescriptions and not even wait in a line. So that's the one I personally use. And then you also have Express Scripts, where you can actually, for our beneficiaries, pay a small shipping fees to have that shipped to your house. And for active duty, that is $0. So we put all those in place so you can actually have easier access to getting your pharmaceuticals. What I'm going to do now is turn it over to Command Sergeant Major Reynolds, who will tell you a little bit more about how you can get more information at your fingertips.
Thank you, ma'am. I'd just like to take the opportunity to thank those personally in attendance in person, those virtually. Thank you for tuning in and listening to the questions that are asked, and then creating shared understanding across the market on how we are trying to improve access to care for you all. And I'd like to take the time to say thank you to everyone on the team across the entire market for everything that you do every single day to take care of our joint warfighters, their families, our beneficiaries, and all of our patients and customers that are seen across the market. Thank you so much. We truly appreciate that. Another initiative that we've stood up is the Beneficiary Text Service. And it's going to be put in the comments, the number that you'll need to text something to, and what you need to text to that number if you want to receive valuable information across the market, either from BAMSI or the West, that could help you, attain access to care. Back to you, Elaine.
Thank you so much to all our leaders and panel members. Thank you so much for being here. We're really excited to answer the questions. As noted earlier, you're welcome to post your questions in the comment section. We're monitoring, so please post away. We're excited to get your questions. But before we get started, actually, we do have one more speaker. Lieutenant Colonel Erin Kaiser is going to provide us a walk-in contraceptive update. And she's the program manager for OBGYN. Welcome to you, Lieutenant Colonel Kaiser.
Thanks so much. Good morning, everyone. I just wanted to let everyone know that as of the last year, we now have 5 walk-in contraceptive clinics available in our market, and they are located at Troop Medical Clinic, Moreno Clinic, Wilford Hall Ambulatory Surgical Center, Reed, and Randolph Clinic. There's a flyer that we've posted throughout, if it is hopefully going to be up right now, that tells you the days and hours. Some are once a week, some are twice a week, and who is eligible to go to them. So for True Medical Clinic and Reed, it's trainees only, but then permanent party and active duty can access the other ones. I also want you guys to be aware that there is a great app put out by the Defense Health Agency called Decide Plus Be Ready. You can find it on the App Store. It's a shared decision-making model that walks you through the different types of contraception based on your personal desires and plans. So it's really helpful if you've already looked through that when you go, just to make the appointment more efficient. Thanks so much.
Thank you, ma'am. We're going to welcome Colonel Yoon back up here to the panel. I'm sure there'll be a few questions for her. So to get started, I'm seeing people are starting to submit online. We really appreciate that. Thank you. So we'll go ahead and get started with the questions. So Desiree, thank you for submitting. She mentions that she's waited several weeks for a behavioral health appointment, and it was canceled and rescheduled over 35 days later. Waited weeks for a woman's health appointment, only to have it canceled and rescheduled over 40 days later, and also about general surgery. She asked, should we expect this to be the norm? in our care.
Sure. No, thank you for the question. And truly to Ms. Desiree, we apologize for the cancellation of the appointments. But that's not the expectation for the behavioral health care. Our goal is to get you within, once you request an appointment for behavioral health care, within at least 30 days, within that time frame. So while we unfortunately at this time are not able to meet the needs, we're about 45 days out. We're working with our front desk staff throughout the market, as well as with Camo, with addressing the patient cancellations and the future appointments with them. So what we expect to see is an increase in the ability of you to request an appointment, and through what we're initially coining our disposition clinic, which it's tentatively called the Joint Warfighter Wellness Center. We're going to be using our behavioral health technicians, both 4 Charlies and 68 X-rays, who'll be coming in and serving as that first point of contact to conduct the intakes. So what Ms. Desiree is explaining is her cancellation and an ability to get back in. We're going to increase the access to care. As a matter of fact, we're actually piloting it right now, where technicians are conducting the intakes, and then the next appointment with the provider will be the initial follow-up. So we expect for this to decrease the amount of time within the next couple months, but most definitely we can definitely address that with Ms. Desiree if we can get her information as well. So thank you.
I think what I'd like to add to that is our number one initiative across the market is to increase our hiring and our ability to bring more staff members on to Brooke Army Medical Center so that we can better serve the community. As you can imagine, during the pandemic, there has been a nationwide shortage in healthcare providers of all type as people that have, during the pandemic, left the profession. And so we're really working hard, and this is no different than the hospitals around San Antonio are fighting the same challenges of hiring. But to give you an idea, just yesterday, we brought on 48 new people through an onboarding fair. And of those 48, 47 of them have a start date already established. So we are working really hard to get after hiring so that we have the capability and the capacity in the system to meet the needs. What we have as our kind of the balance to that is if we can't meet your needs, then we do rely on our civilian partners so that you can get the care you need. Right? So there's always that balance between what we can do in-house, and then if we can't do it in-house, making sure you have the ability to get it on the network.
And then can I add to that, jumping on the hiring? So I wanted to share some examples I was prepared for later on, but this is an opportune time to meet her needs. So a great example of the positive progress, which is a result of hiring, that's been the heavy push from the market director, so thank you, leadership, is that just in January, for the behavioral health request for prescription medications, we were able to actually maintain it in one location, all in-house. So pull folks who we were previously sending in December off post for prescription medications, and now we're maintaining 100%, in one location, which we expect to spread throughout the market. So that's a great news story with the hiring. In addition to that, the staffing allows us to increase our specialty cares for both trauma-focused IOP, which is growing from 8 to 10 beds, for the Behavioral Health Foundations group, which we expect to rise, which will start in a capacity of 20 beds, and with the Behavioral Health regular group, which is also growing from 8 to 10 beds. So this hiring is impacting behavioral health access to care in a great way. And the push for the onboarding, reducing that time frame, in the next couple months, you're going to see this capacity into fruition. So you absolutely see that. And lastly, too, for even our inpatient psychiatry unit, we've grown from 12 beds, which was traditionally held back from staffing shortages during COVID, up to 16 beds, all within the combination of staff returning to DBH from our taking over from the former WRP, as well as the onboarding of providers. So this is a great leadership push that we really appreciate on the behavioral health side, and we're able to meet some of those needs for our active duty service members. So we're excited. Thank you.
Thank you very much for the answer. Thank you, Desiree, for submitting it. She also gave a shout out to Wilford Hall Pediatrics. She said she's had her children seen very quickly, so she's very happy. Thank you for the positive feedback. So please submit your questions online. I don't see any new ones at the moment, so I'm going to move to the pre-submitted questions. Thanks again to all who submitted those. First one, will medical records from the old TRICARE online website be transferred to the new Genesis patient portal, and when? And I think we're lucky enough to have a patient portal champion here.
Good morning, everyone. This is Calvin Williams. I'm the BAMC Patient Portal Champion. And there are plans to migrate your health records from TRICARE Online to Genesis, but no date has been announced yet. Until that happens, please retain your TRICARE Online link and use that for your past history. Consider printing or downloading your health records prior to the TRICARE Online Patient Portal being decommissioned or retired in October 2023. The TRICARE Online Patient Portal, consisting of secure messaging and TRICARE Online systems, will be retired once MHS Genesis completes fielding. All military treatment facilities are scheduled to transition to MHS Genesis by October 2023. Once retired, the TRICARE Online Patient Portal will no longer be accessible. Be prepared by processing any prescription request. Download or print your health record and save your important secure messages. For your health record data, you can download and save this data to a PDF or store in a CCD format for uploading into a personal health record of your choice. For secure messages, instructions on how to print secure messages are on the announcement on the TRICARE Online link.
Thank you, sir. We appreciate all that great information, and we'll make sure to share some of those details in the comment section. The next one, I think, sir, you touched on this a little bit, but what are we doing to improve behavioral health access to care for active duty?
Great. I'm glad you came back because we're excited also to share that with the launch of the virtual medical centers, telebehavioral health, they've also afforded us 1 FTE, which allows us to, should we not have the availability to keep them in-house, they'll provide the telebehavioral health services. So we are very appreciative to the virtual medical center for their support. For family members, we actually are onboarding and we have approved hiring for 3 providers for child and family behavioral services. So that will actually help us to meet some of the need, for that center. In addition, so we're collaborating. We continue to collaborate with our network providers who are actually providing care for our active duty service members, and that helps us maintain visibility, of the care that they're receiving to make sure they're getting the top-notch care out there, and then also increase communication with command teams, so they have visibility of who's out there, and whenever someone needs to be returned or brought back into the system, then we're able to bring them in, fully.
And I would also add that in the Access to Care app and the new guide, we also highlight 2 different ways you can get your care through telehealth. One is through Doctors on Demand, and this provides both urgent care and behavioral health care, and it does not require referral for our beneficiaries unless you're active duty. Active duty does require referral to use Doctors on Demand, which can be achieved from the nurse advice line. The second one is Telemind, which provides comprehensive telebehavioral health care. And again, for all of our beneficiaries can access that, active duty would require referral before they use that. So we do have some telehealth options available for you that you can leverage.
Thank you very much. For those who just joined us online, and we appreciate everybody who is watching online, please post your questions. We welcome your questions on access to care or any other related topic. Next question. When can we view all of our results and measurements? I can only view my 2022 results and measurements. I can't view any earlier than that.
I can take that one, Elaine. This is Calvin Williams. Your results and measurements in MHS Genesis are those that were entered into your health record following MHS Genesis Go Live on 22 January 2022. Your results and measurements prior to 22 January are in your TRICARE Online health record. There are plans to migrate your health records from TRICARE Online to MHS Genesis, but until that happens, retain your TRICARE Online link and use that for your past history. Recommend you print or make a copy of your health records for easy access so that you have access following decommissioning of the TRICARE Online patient portal.
Thank you, Mr. Williams. We did get another question from Facebook. Thank you to Crystal for asking your question. We appreciate you. She asks, is there a way for me to access my minor children's, their age 13 and 16, health records and MHS Genesis? Asked a clerk at one of the outlying clinics, and they were unsure of how I can request access. Accessing health records on Genesis.
I can take this. I mean, briefly, the answer is no. This is an issue with privacy, essentially, in adolescents that the DHA has. We're not, they're not authorized essentially to put that where the patient can see it, and the adolescent can't request their own account either. This is something that is a known issue. They are working on it specifically with regard to adolescents with developmental delays who may be in a position that their parents really need a lot of engagement on this. Also, we have a subject matter expert in the room who's created some videos on how to kind of best use the patient portal in adolescents. And so, Dr. Matos, if you have anything to add on this, feel free.
Sure. Hi, this is Renee Matos. I'm the Chief of Pediatrics. So we did go ahead and create some videos to help with how to access the patient portal, including how to create a DS logon, which can only be used for patients or for beneficiaries over the age of 18. But it does go through how to access your health records, and it is a known limitation for our adolescent patients. And so we do recognize that issue, and we're hoping to try to advocate to fix that.
Yeah, in the meantime, if you do need your adolescent's health records, the best way to do that is through medical records at the hospital.
Thank you very much, ma'am and Colonel Matos. We'll post the links to those videos in the comments section so everybody can see that. Any other questions online at the moment, although we very much welcome them. Pre-submitted question. In the past, it was possible to receive an immunization from your primary care manager as a walk-in appointment. Now patients are being asked to schedule an appointment. Is it going to stay that way?
So I can take this one. Immunizations is kind of a broad topic. Not all of the primary care clinics have immunizations built into them, actually. WASC has a very robust immunizations clinic, and those clinics, those primary care clinics send their patients to the immunizations clinic to get immunizations. And then if you're already at the PCM visit for your checkup or your appointment or whatever, typically you can get the immunizations done at the same time. The issue is really around walking in when you don't have an appointment, there's nothing scheduled, and the ability for them to create an appointment in real time. So that's what those appointments are for. Immunizations also encompasses a lot of things to this audience because we're talking about routine sort of everybody needs a flu shot every year. Everybody needs a pneumonia shot when they turn 65. But then we also have deployment kind of vaccines. We have things like anthrax and yellow fever that might only be required in some people. And those are still available as a walk-in basis through the immunizations clinic at the WASC and also at the Troop Medical Clinic for people who are eligible to receive those. And also, don't forget, you can get vaccines on the network through any of our network partners, typically with no cost, and frequently with that integrated into our medical record because of the way the billing works.
Thank you, ma'am. Appreciate that response. Without any questions online, I'm going to stay with the pre-submitted questions. Can network providers be given access to fill prescriptions for 65 and over patients? My specialty doctors in BAMC are unable to renew or won't renew a maintenance prescription because they didn't prescribe it originally. I appreciate any support you can provide the over 65 population. I think we have a pharmacy expert here.
Good morning. My name is Colonel Causey, I'm Chief of Pharmacy here at BAMC and also the market lead for pharmacy market lead for JBSA pharmacies. To answer the question, the short answer is yes. Patients 65 years of age and older can get prescriptions filled here at BAMC from network providers. The way that works is that the network provider can electronically prescribe a prescription directly to one of our pharmacies, either at BAMC, Lackland, or Randolph. And there's a electronic code or address that you can use, and I don't have that in front of me right now, but you can request it through the pharmacy to get that electronic address if your doctor's office doesn't have it. Most providers in the community already have that address or it's electronic prescribed, but you have to ask your provider to electronically prescribe the prescription directly to the pharmacy here at one of our pharmacies in the JBSA market. Once that's done there, you just come to the pharmacy, request the prescription to be filled. We'll fill it for you. If you can't get electronic prescribed, you can also have a hard copy prescription brought to the pharmacy except for controlled substances. Also, the other part of the question was, why can't the doctors write for renew your maintenance medications from another doctor? Potentially, it's not safe to do that. One thing on our regulations actually talks against doctors rewriting prescriptions from another doctor, and more because the doctor doesn't necessarily have the whole complete medical history for the patient. And out of caution for the patient's safety, they requested that doctors do not rewrite prescriptions from another doctor. Thank you.
Thank you, sir. Appreciate it. Next question. Is there a more patient-friendly way to activate new medications versus renewals? The process has become more confusing since the transition to MHS Genesis. For example, some patients may not have text messaging access to text the activation number, or be aware that activations afternoon are processed the following business day.
Thank you, Ms. Sanchez. It's Colonel Causey again. To answer the question here, all GBSA pharmacy locations implemented the use of Q Anywhere mobile text to activate prescription service to provide a more easy and convenient way for patients to use to text messaging to request to activate their new electronic prescription. Refills cannot be requested via this service. For those patients who cannot use the Q Anywhere mobile text option, the BAMSI pharmacy call center is available for BAMSI patients only to request to activate prescriptions with a pharmacist or a technician. The number to call to activate a prescription for all BAMSI prescriptions is 210-916-1536, option number 6. Patients can also come to the pharmacy and request to have prescriptions activated in person. If you request to activate all your prescriptions at BAMSI before noon, they'll be ready to pick up after 1400 the same day. If it's afternoon, the prescriptions will be ready for the following day after 10. For Lackland and Randolph Air Force Base patients, all patients are required to either request to activate the prescriptions via Q Anywhere, and or they may come to the pharmacy in person to activate their prescriptions in person. There is no phone activation process for Lackland and Randolph patients at this time. That has been worked on right now to have a market-wide call center at some point down the road. Please note all prescriptions be activated at Lackland and Randolph may take up to 2 duty days to turnaround time for maintenance medications. For any renewals of prescriptions, all patients may send a message via the MHS Genesis portal to the provider to request a renewal of a currently expired or outdated prescription as needed. This process works for all GBSA clinic locations. Thank you.
Thank you. And if you didn't catch all that, we'll make sure to post it in the comments section, all the details and the phone number. So thank you. Thank you, Colonel Causey. I'm going to skip the next one just to give our Genesis folks a break, and we're going to ask the next one. BAMSI accepts many compassionate reassignments, yet most providers in the general pediatric clinic are over capacity. This makes it where our compassionate reassignment children are forced to go to the civilian network for pediatricians. Why do we accept compassionate reassignments if TRICARE can't enroll them here?
Yeah, so that's a good question. I can take that. I mean, first of all, just the question of compassionate reassignment really has to do less with which individual clinics have capacity and more to do with, can the community support this individual and their medical needs? That being said, we want to address your medical needs within our market. And we are actively managing things within the market with pediatrics. Pediatrics actually is relatively in a good position with access. BAMSI Pediatrics is open. We already got some positive feedback from Desiree about WASC Pediatrics and a timely appointment there. But we actually move people around the market too, sharing support staff, sharing nursing staff, just to try to keep things open as much as possible in general pediatrics and in primary care in general. Pediatric subspecialty support is another, that wasn't part of the question, but I can talk that too. You know, that's one where we sometimes have some challenges. We'll have one subspecialist of a particular flavor, and then they have to do training or they get deployed or something like that. And that's another case where sometimes access is thin in the community and it's thin nationally, and there's just not a lot of developmental pediatrics or genetics resources. We always aim to, and we typically do have earlier access into our clinics than we do in the community there. So just proud of our PEDS team for doing a great job trying to plug all those holes and take care of these complicated patients and families.
Turning it over to Colonel Matos.
This is Colonel Matos again from Pediatrics. I actually think Colonel Yoon covered pretty much everything I would have said. Like she mentioned, BAMC Pediatrics and Adolescent Medicine are open. We are short providers overall in the network or in pediatrics, but we have really tried to help out our other facilities. So we're sending a pediatrician to WASC a couple of days a week to help with their access. And we're also sending a pediatrician to family medicine to help their pediatrician out as well. So we're doing everything we can to maintain access within the community and within the San Antonio market. But we are open, so we would love to see your kids.
And I just want to kind of foot stomp that last part. If you, at some point, were told we weren't open for enrollment, we are open for enrollment for children, please bring them to BAMC Pediatrics or in the Marino Clinic for Adolescent Medicine. We are open for enrollment. Thank you.
My last little segue before we leave this topic and before I forget about it, you know, we've talked about some open hiring positions and really our efforts across the market to hire against some of these staffing shortages. So if you know of really awesome folks that want to work here, anywhere in our market, but primary care is a great example, pediatrics, we would love to hear about those people. Please send them our way because chances are we've got an open hiring action.
Thank you so much for the team effort on that question. We appreciate that. We did get an online question. Thank you, Jordan, for stepping up here. Love this question. Jordan's asking, has there been any thoughts of adding a service like Teledoc for acute types of appointments?
Well, yes. Yeah, so our partner Humana for your TRICARE benefit does a very nice job with Doctors on Demand. It is a really good resource for acute needs of our community. In addition to that, you obviously, as a beneficiary, can go to an urgent care clinic. Again, active duty would need a referral to be able to do that. But we would love to keep you in the system, right? And so we would really love for you to use that Doctors on Demand. So far, the feedback on people that have leveraged that technology have really enjoyed it. And with that, we're also going to go back to our favorite pediatrician.
I was just going to add that you can also schedule a virtual health appointment with your PCM, and those appointments are available to book on the patient portal as well as through Camo. So that's another option if you just need a virtual health appointment. Those are available.
My pile-on to her pile-on is that, you know, most of the time when you're thinking about a virtual appointment, maybe you're thinking of like a visual as well as a phone call, and what you've been getting maybe was mostly phone calls. We're going to be making a big effort, a big strategic push really in the coming months to try to maximize use of one of the features of MHS Genesis that really is an improvement, and that's this integration of MHS Video Connect into the medical record. So look for some messaging about that as the time comes. That is a resource that we really have a lot of opportunities with.
Thank you. Awesome. Thank you, Jordan, for asking that question. I'm going to do a pre-submitted question. For those over 65 have Medicare and have been transferred to a civilian provider, I understand primary care will remain civilian, but can they be seen at BAMC for subspecialty care? And if so, how do they get that referral?
So this is an interesting one, and there's the direct question to answer, and then there's all the other pieces that I want to unpack a little bit here. So, you know, turning 65 in the current environment, by and large, means being transitioned to network primary care. Subspecialty care is still available in some clinics. However, how to get that referral to the clinics is a little bit complicated. We're going to be making a concerted effort in some particular clinics who need particular types of cases and patients to be pushing this. And we've had projects in the past where we had sort of a streamlined pathway for getting those in. Not all clinics are going to have capacity for over 65 in subspecialty care, and that's just a fact. But if you, like, for example, I will say the infectious disease clinic where I see clinic, they have capacity. And if you wanted to be seen in our ID clinic, then you could call the clinic and they would probably be able to get you in. You don't even need a referral for travel clinic, which they see there, and we see patients over the age of 65 there all the time for travel clinic. But if you're trying to get into something where they're, not even able to get active duty family members in, it's probably not going to happen yet. What you would do is you would call the clinic and you would see if they have capacity, and then you would bring in a copy of the referral from your PCM in the network. That's a lot of words and it's complicated. For those that are under 65 but that are retirees, we actually, even if you are in a network PCM, we have a right of first refusal for a lot of our clinics. So if that comes in through TRICARE, we will see that consult and we will try to get you into one of our clinics if possible. And then don't forget hospital stays, because a lot of patients over 65 think, oh, my PCM's in the network, my cardiologist's in the network, I can't be admitted at BAMC. That is not true. You can be admitted at BAMC. We would love to take care of you at BAMC. And if you need to be admitted to the hospital, please think about us. If you need to go to the ER, you can come to our ER. And obviously pharmacy, lab, radiology benefits are there. So that's a lot of words. I don't know if anyone else has anything to add there.
What I wanted to add is that we talked for strategic communication that we are going to do an evaluation, a validation of what are the specialty cares or services that we could provide to our 65 and make it more of an open book to you and more transparent, so you're not trying to guess. And how do you contact those clinics? And so you should see that in the next 30 to 60 days, that there will be very specific over 65 information so that you are not trying to look through multiple locations for that information. And so hopefully that will allow individuals to get the care that they desired within our market when they're over 65. We want to take care of you.
And what we would love to be able to do is, one, put it on the app that just went live, right? So you'll have a page for over 65 so that you can easily find that information. Two, sign up for our new text service so that as that information is live, we will push that out to you. And then three, we'll obviously put it on normal avenues of communication, whether it's social media or websites, et cetera. But we're wanting to make that information more accessible to you so you don't have to kind of think through, can you get this care at BAMC or not? We want it to be easy for you to know, because we do want to care for you. We want you to come into BAMC when we have that ability to care for your needs. And I'd just like to foot stomp what Colonel Yoon said. If you feel you need to go to the hospital, we want you to come to BAMC. We'd be glad to care for you.
I just want to take the opportunity to say to all of our 65 and other over beneficiaries and retired service members, thank you for your contributions, to our military and to our American people. And we honor your service, and if there's a legal, moral, ethical way to get to yes, we would love to take care of you.
Thank you so much. I'm going to do a quick commercial for our new text service. It's open to all beneficiaries across the market, across the city. You just text the word MILCARE, MILCARE, to 1-877-345-7262. We want you to opt in today. By impromptu PSA. Next, pre-submitted questions. And for those who are joining us online, we invite you to ask questions about access to care or any topic, and we'd love to answer your questions. Pre-submitted question: when can we use MHS Genesis to refill our prescriptions? The telephone order system is not always up to date or accurate.
This is Calvin Williams again. DHA understands that the ability to refill prescriptions through MHS Genesis is very important to our beneficiaries. A project has been initiated to implement an enterprise-wide prescription refill solution with the capability to support refills via the patient portal. The target date for completion of this capability is February 2024, unless delays are encountered. At this time, please call the telephone number on your prescription package to request a refill. When you no longer have any refills, you can press the Renew button under Medications in the patient portal and complete the prescription renewal information. Thank you, Elaine.
Thank you so much. John had a comment online, and we really appreciate your comment. He mentioned, a lot of 65 and older may not be on social media or download apps, and they may not get the info, but there are other avenues. Like General Tahan said, we'll put stuff on the internet, General Ryder mentioned. And if there's a specific way you like to get your information and you're over 65, please let us know, give us that feedback.
And we're still doing hard copies, right? So we're also, if you come in, we have hard copy information to be able to provide you. We really feel it's important that we need to meet people where they need to be met. And that means that we have to have different ways of communicating for all the generations that trust the San Antonio market with their health.
Thank you so much for that comment. We really appreciate it. Another pre-submitted question, is it possible to have clinic hours extend later? Having clinics that close at 4 p.m. makes it very difficult for those that work until 5.
Yes, thanks for that question. And most of our primary care clinics actually do have extended hours. It's clinic dependent, and we compiled all of that information, and Ms. Sanchez has access to it, and we'll make sure that it's posted. But most of the clinics, the primary care clinics, actually do have some extended hours into the early evening to take care of those things that really you don't want to try to deal with during the workday or during the school day for your kids.
Fantastic. And we will post those hours in the comments section. Are there any plans to have physical therapy added to the Taylor Burke and Bulverde clinics?
So we are looking across the market for the best places to put physical therapy, and we actually have right now an initiative to improve direct access for physical therapy. That's not just for our active duty clinic that's at the Marino clinic, but across the market. And we had people this week from the Defense Health Agency working with us on how we would actually do that. In particular to the question, we do have a hiring action for the physical therapist at Taylor Burke, and we hope to fill that soon. For the position at Bulverde, the challenge is space, and so we do not believe we will have a PT out there just because the facility doesn't have space for that type of clinic.
Thank you so much, ma'am. Many civilian hospitals and some VA hospitals have achieved magnet status certification. Is BAMC going to aim for the status to continue to provide safe patient care, save money, and be able to retain quality, competent, and caring staff?
So I'm going to take that one. So magnet status certification, it is very incredible. We have some challenges due to the transitory of our staff, especially with the military, but there are multiple accreditations that BAMC and WAS, when you talk about the Joint Commission, CAP for the lab, or our accreditation of our trauma center, and those kind of things. I will say is that we have ready, reliable care, and all those things that you are talking about when you talk about safe patient care, that is the #1 priority, not only within here in the San Antonio market, but also for Defense Health Agency. We have a new DHA director, Lieutenant General Crosland, and she will say that is the #1. What we do is about safe patient care. We've talked a lot about how we are doing our hiring processes. I think some of the challenges is making sure that we have all the right people in the right place as we ruthlessly prioritize where to place those, especially where is the right care at the right place. And then in regards to, I think we're always looking on how do we care for our staff? How do we make sure that we have an environment of respect and dignity? We know that 2020, 2021, 2022 was challenging. And so ourselves as leadership team, how do we get back to basics? How do we make sure that we onboard people correctly, whether they're military or they're civilians? How do we make sure that we're force developing, and how are we doing all those things? So yes, magnet accreditation is an amazing, but I believe that we have all the pieces of the puzzle to make sure that we're getting at these 3 things.
Thank you so much, ma'am. We're coming up at about the 15-minute mark. We only have one more pre-submitted question, so if you have any questions online, this is the time, or even comments that you'd like us to share. Really appreciate that. Yes, ma'am.
I don't have a pre-submitted question, but I do have a comment. And Ms. Sanchez, a few minutes ago, you gave out a number connect with us for text messages. I want to put in a PSA for Ms. Sanchez's PSA and a promise. We are not going to spam you. We are not going to hammer text you. What this is going to be used for is things like, there's a winter storm and we had to convert a bunch of appointments to virtual today, and please check before you go to your appointment. It's going to be timely information like that so that you don't waste your time and put yourself at risk or struggle to figure out which Facebook page to go to. It's really for those kinds of direct things. So if you did not already register for this, please take a moment and do that, because it is going to be really a game changer for us in our ability to communicate with you.
Thank you, ma'am. Appreciate your PSA.
It's important, Elaine.
Extension.
Yes.
Yes, I agree. Again, text the word MilCare to 1-877-345-7262. And the number is on the comment section. Next, last pre-submitted question. Nutritionists can tell us what we need to do, but they're mostly academic and hard to put their principles into cooking or buying food. Can we have people work with the Wellness Center to translate the nutritionist knowledge to our everyday eating and cooking?
Well, the great part about here at Fort Sam Houston and the Joint Base San Antonio is that we have the Vogel Resiliency Center right in the middle of our installation, which has actually a teaching kitchen, which is incredibly unique. And you can actually sign up for the teaching kitchen classes, and they teach you how to make healthy food that's quick and inexpensive but tastes good, right? It has to meet all those criteria for it to really be what you need. And the Vogel Resiliency Center hosts teaching classes throughout. We also have there what is historically known as the Army Wellness Centers being rebranded as the Armed Forces Wellness Centers that allows you to meet with a health coach. And this health coach will help you along the way with any of your health goals, whether it be from a nutrition standpoint or any of the other aspects of holistic health. And this is open to not only active duty and family members, but our retirees and our DOD, DA, and U.S. Air Force civilians. So they all can go to these resources at the Vogel Resiliency and at the Wellness Center. But more, if you step back from that, what they've really created at the Vogel Resiliency Center is a holistic campus for your health. They have yoga, they have mindfulness, they have resources available to you. They actually have counselors that are just before the need of needing behavioral health, right? So if you're dealing with a family life stressor and you're like, well, I don't think I need behavioral health, but I do need to talk to somebody, they have counselors that will be able to help you. They can connect you also with financial counselors. So if there's a financial stress that's leading to health issues, there's ability to get to financial counselors. So if you have any type of life stressor and you want to go seek help, the Vogel Resiliency Center will help you with those and match you to the resources you need. For the last couple months, we've been doing videos on this and posting them on our website to make sure you understand all the resources there. But we hope you use the Vogel Resiliency Center and the Armed Forces Wellness Center, because we do want to help coach you along your way to your journey for better health.
Thank you, ma'am. Appreciate it. And Cynthia has a question. Appreciate that question online because we were almost out. I have a question about being able to get eye exams. I previously saw optometrists at McQuethy. Is this still possible?
So optometry, generally speaking, has capacity, and I don't know, if Cynthia's active duty or a family member or a retiree. They have some capacity for all types of patients in BAMC optometry because they have a training program. They have an allied health mission to support. They also have some staffing challenges. And so their capacity is a little bit of a struggle at the moment or in the next few months compared to where it's been. Optometry has also been a source of confusion for a lot of people over the years who think that they need a referral to go to optometry. You do not need a referral to go to optometry. And in fact, if you have TRICARE benefits, then those benefits also are good in the network. And you can just go to a network optometrist and use those benefits if you cannot get an appointment in BAMC optometry as a beneficiary. But active duty will be able to get seen in any of our optometry clinics across the market.
Thank you very much, ma'am. Well, I don't see any additional questions online. I'm still keeping an eye out. We're done with the pre-submitted questions. So at this time, we'll turn it over to the panel for closing remarks.
Who wants to start?
Can I start? Oh, thank you. So I wanted to chime in on the pre-behavior health or before with the Vogel Resiliency Center, and I want to just assure that everyone online here that that we're working closely with the Vogel Resiliency Center. They're actually doing a phenomenal job with standing up programs there, and being the precursor to what would ultimately lead you to the correct resources. So if you think about it, new service members that are coming in, they're going to get this taste, a touch point, which will assess their needs, right? They'll be exposed to Army Wellness Center, they'll be exposed to the teaching kitchen, but they're linked with us. So what we're doing is we're communicating together, we're ensuring that we understand how to get into behavioral health or how to refer back to the Vogel, because not everyone that comes into our behavioral health doors for triage or disposition is gonna need the higher level of care. And that's okay, because that's why we have these pre-behavioral health services. And I'm so thankful to the program for starting out the Vogel Resiliency Center, and they're doing a great job. And I want to just promote them as well. So thank you, ma'am.
So I can go next, if that's okay. So I'd just like to reiterate our appreciation again for the feedback that we're receiving today and continuously from our patients. Our commitment remains the same to improve our own processes. We often walk our own processes too to see what they look like, and so we will remain, or that will remain a priority for us as we look at how we can better deliver care in the way that you would like it to be as well. I would be remiss if I didn't close by addressing our staff. And so to our staff, I'd just like to say that taking care of you is also a priority. We remain dedicated to your personal and your professional development, and we want you to know how much we appreciate what you do, your commitment, your dedication, and your contributions each and every day. This month we celebrate you with our random acts of kindness across the market, and but know that our appreciation for you is every day for just what you do and what you're able to accomplish. So thank you.
Just say we really do appreciate your feedback. You may think sometimes, what's the point? You know, they get emails all the time. Patient experience office hears from enough people. You may think that, but every time we get an email, every time we get a phone call, we look at it, we think about it, we act on it, and we use it to try to make ourselves better. We are all thrilled with our staff. We're so proud of our staff. We're so proud of our team. We're so proud to be part of this team, and we're never satisfied. We're never satisfied with how it is today. We always have a vision for how it could be better, and we want you to be co-creators of that with us. So as has already been said, this is our healthcare system also. This is where our own husbands and wives and children get their care. And so we have skin in the game. We want to fix this for you. We want to fix it for us. And we want to have a brilliant working environment for our staff at the same time. So thank you for your patience. Thank you for your feedback.
I just want to throw a vouch out to the Vogel Resiliency Center. I've gone through there several times with the current commander and previous commanders, and their services are outstanding. And so, second that, take advantage of that capability if you need it. And then second, I thank our staff for the great things that they do across the entire market to sustain that trust with all of our patients, all of our joint warfighters and family members and beneficiaries that utilize the military health system here in the San Antonio market. Thank you for trusting us with your care.
I would just like to thank everyone for tuning in today, because it means you want to be part of the solution to make your healthcare system better. I am incredibly impressed with the team here at Brooke Army Medical Center and across the market. It's been an honor to be here the last 6 months working in both of those lanes and seeing how hard the staff and the team and everyone's working to care for this community. I also would want to kind of highlight that for those calling in, you might have put some of your health priorities on hold during the pandemic, right? Did you do your colonoscopy? Did you go in and get your mammogram? Have you gone into those things that we know prevent disease by allowing us to catch it early and intervene before it provides a significant health problem? please do not delay anymore. We want you to come in. We want you to do those preventive health checks, and we want to make sure that we're a good partner with you and not just treating you when you're ill or injured, but we're here to help prevent injury and illness. And we just want to make sure, and we know so many people put so much on hold during the pandemic. We are ready to serve your needs here in the San Antonio market. General Ryder.
So I just want to thank everyone for your participation. Time is valuable, time is priceless. What my hope is, and hope is never a plan, is that you see the seriousness that we take in taking care of you every single day. That this is people business, this is family business, that we are blessed and very fortunate to take care of the sons and daughters, the moms and dads, and the grandmothers and the grandfathers of this nation. And what we do here is very complex. It is the most complex market within the Department of Defense Health Agency. And so while we are making sure we have a ready force and that we are taking care of your injuries and your sicknesses and all those kind of things, but we are also, as everyone has said, is taking care of our staff. Because what we do every single day, it's hard. It's really challenging. And we talked about a multiple of challenges that we're having, and there is 50 or 60 or 70 more things that we could work on. And so just to let you know, not only for the staff, but for our patients, that we are ruthlessly prioritizing, that's a very hard word, to make sure that we are taking care of your needs, and that your patient experience, your staff experience, if you are a staff member, we want you to take something away from the San Antonio market with you, whether it's clinical, personally, or professionally. And so I thank you for what you do every day. I thank you for the teammates that I have here every single day and what we have worked as the San Antonio market between all the services to take care of our beneficiaries.
Thank you so much. Thank you to our distinguished panel members and our subject matter experts in the room behind the scenes. We appreciate your knowledge and expertise. Thank you to everybody who tuned in to watch and for all of the great questions. We'll continue to monitor for questions. We'll respond to any that we see. We will continue to provide updates on the web and on social media. And please know that if you're not on social media, let your friends know that we'll also share this video on YouTube. So there's another avenue to view it. And this concludes today's town hall. Thank you for tuning in.